Hello, Colin Hung here for Healthcare IT Today, and I just got back from attending the Oracle Health Summit in Nashville, Tennessee. During the summit, there were several big announcements from the company around becoming a QHIN and their next generation EHR. For more on that, check out my summary in the link below. There was, however, some news from Oracle that did not make the headlines. They announced a new talent marketplace to help healthcare organizations with their labor challenges. Kristen Miles, who is the VP of Healthcare Product Strategy, joined me on camera to tell us more about it. Let's get to it. Welcome to the program.
Thanks. It's great to be here.
I'm excited to be here at Oracle Health Summit. But before we dive into the questions I have for you, can you give us a quick introduction, your name, role, and what you do here at Oracle?
Absolutely. I'm Kristen Miles. I'm the Vice President of Healthcare Product Strategy for our Fusion Cloud applications. I'm really responsible to make sure that our operational solutions meet the unique needs of healthcare.
Kristen, I'm excited to dive in because this is going to blend two areas that I don't normally talk about. So this is going to be a lot of fun. But according to the U.S. Bureau of Statistics, they're saying that there's going to be like a 2 million personnel shortage in healthcare over the next couple of years. How is Oracle going to help address that?
Yeah, so it's such a critical area, right? And an area that we've invested heavily in just to make sure that we have the right people in the right jobs. And some of the solutions that we've provided is Talent Marketplace. We just announced it this week. And now it's really about how do we get contingent workers? So that specialized skill set, healthcare providers are using third-party staffing agencies. And with the Talent Marketplace, we're now able to send those requests out to third parties. Historically, it's been a phone call to a staffing agency, very manual, really time-consuming and expensive. And in this case, you can send that to multiple agencies. We've just announced a partnership with Medley, who is a staffing agency, or you can use the one that you've been historically comfortable using. So really exciting way to quickly get talent in. In addition to that, we have the ability to now upskill, enroll. Okay. So if you are a brand new to practice nurse and you want to move up and continue that growth within the organization, identifying those skills that you need, and then offering those trainings within our applications.
I mean, I got to be honest, like Oracle has such a powerhouse position and has done so much in other industries around HR and around supply chain. Are you kind of saying that they're bringing that kind of expertise to the game here in healthcare?
Absolutely. So that's one of the great things about having Oracle Health join our company is that we're taking that expertise and that knowledge from a clinical perspective and bringing it into the operations.
So are you going to be working on things to help with the supply chain itself in terms of physical goods and other things that hospitals and health systems need to bring in?
Yep, absolutely. So that within the supply chain, it is nuanced, right? In that you don't know what the patient's diagnosis is going to be that walks through your door.
Sure.
So predictability is difficult, but we have offered and just announced our inventory shortage workbench, which allows you to quickly see where you're potentially going to stock out, allow you to move products around to meet your needs today. In addition to that, we've announced our RFID partnerships with Terso, Zebra, and Avery Dennison, where we can now allow, without asking more of the clinician, to know exactly when something stocks out on the nursing floor and quickly generate a replenishment order.
So it sounds like a lot of what Oracle is doing is really help their organization be a lot more effective with the people that they do have and with the supplies they have on hand. Because right now, of course, we're running into a big problem with the IVs and other things. So if someone was using Oracle more integrated, how might Oracle have helped with that kind of a situation?
It's a great question. It honestly, we can, number one, know that there's a disruption happening. You're able to identify functional equivalence. We have a partner with Symmetric Health Solutions who can identify by attribute other available products on the market, pull those in and allow you to quickly pivot. In addition to that, when you start looking across where do I have the IV solutions today, you can move them from non-critical places and take a look at that. In addition, with our partnership with Oracle Health, you now can say, well, maybe we make a change to our practice of care. We're going to use oral hydration versus an IV hydration. What products do we have what's the impact of the clinical staff? And because we're in one tech stack, we're able to start to leverage all of the pieces of information to quickly pivot.
Yeah, unfortunately, in our global supply chain, right? Like any little disruption, a hurricane here, a supply issue somewhere else, it really can have a devastating impact on certain surgeries and certain provisions of care.
100%.
And so knowing this kind of ahead of time and knowing alternatives, I mean, it sounds like it's going to be pretty good for a healthcare organization.
Yep, absolutely.
Now, Chris, I've spent a lot of time asking you some questions. Is there anything we haven't covered that you would like to tell our audience?
No, I think the only other thing I would mention is that we have a great mobile recall solution that we've just brought to market. We've announced our recall curation service, where we intake the data that suppliers are bringing to the FDA. We help enrich that data so that we can pull it into our system and identify any potentially affected goods that are laying on your shelf, so that you can quickly mitigate that. So patient safety is one of our key initiatives here, and that's one of the ways that we're working on it.
I love it. Kristen, you've shared a lot of great information with us today. Where can people go to learn more about Oracle and Oracle Health?
Oracle.com and underneath the healthcare banner.
Amazing. Kristen, thank you so much for being on our program today.
Thank you so much for having me. Appreciate it.
Hey, I want to thank Kristen for coming on camera with me and sharing more about Oracle's talent marketplace. I think anything that can be done to make that process easier will be welcomed by HR and clinical leaders. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head on over to healthcareittoday.com, where you will find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.